Hello, welcome to another Talking Beyond Trauma program. My name is Mordecai Dixon. Today we're going to take a look at some difficult information and have some difficult conversations. We live in one of the most developed nations in the world and are surrounded by resources. The sad reality, though, is not everybody benefits from the resources in their country, in their communities. This not only impacts their wellness, but their ability to experience health and wellness. Today we ask the question, with all these resources at our fingertips, what gets in the way of certain groups trying to reap the benefit of the stream of plenty? We discuss the issue of health disparities, their origin in our nation's history, the difficulty of certain ethnic and racial groups overcoming system-based marginalization, the ongoing challenge of these same groups to be recognized, valued, and afforded opportunity to pursue wellness freely and without impediment. Today we are speaking with Dr. Tonicia Freeman Foster. Dr. Foster is an authority on health equity, organizational leadership, and leadership development. We are glad to hear perspectives on how to have difficult conversations, how to build effective organizational structures that promote wellness, and to address systemic problems that, to this day, exist in our society.
This season of Talking Beyond Trauma is intended for mature audiences. References made to policies and practices within the United States impacting African enslavement, racialized medicine, and assimilation of Native American and Indigenous cultures is explored in the session dialogue. The program addresses the impact of systemic racism on the physical and mental health and wellness of Americans identifying as Black, Indigenous, or other persons of color. The content is presented to examine historic U.S. initiatives that influenced, designed, and maintained oppressive systems impacting access to service, disproportionate service efficiency, and generational mental and physical health challenges. While we acknowledge the need to explore these issues with courage, we remain committed to culturally sensitive, equitable, recovery-focused programming. We aspire to minimize stress reactions and the re-traumatization of our listeners. Please review the session descriptions and make informed decisions prior to exploring content. Resources are available if you wish to explore the content in greater detail. Thanks for your support of Talking Beyond Trauma. We hope this discussion fuels your practice and promotes healing in your journey. Previously on Talking Beyond Trauma.
The history is necessary. So I think a lot of times we shy away from things that make us uncomfortable. And there's a theme here because we shy away with conversations that make us uncomfortable, but we also separate ourselves from people that make us uncomfortable. And so I always think of history as the foundation of a home. And so if your home is sinking because the foundation is cracking, you could have the nicest paint, the nicest windows, but if you don't fix the foundation, it's like standing in quicksand. It just continues to fall apart. And so it's that's hard work though, but it's necessary work, not only to learn about history, but understand how it's repeating itself, how it's evolved, and where we may not be in the modern sense enslaving people. We are still doing other things that keep them oppressed, that keep them sad, that keep them unwell, that keep them unhealthy, that keep them in systems that are punitive instead of systems that care.
We are back. We have had a great conversation. I am glad to have Dr. Tonicia Freeman Foster back. We're going to pick up where we left off. Last time we met and the last time we talked, we had a stimulating conversation about history and its impact on our ability to function, really. I think when you sum it all up, that's really what it comes down to. And for some people, because they were consciously and willfully left out of the equation, the impact that had on not just them at that point in time, but their families, their generations that followed. there's some nice layers in that. And the first one I'm going to start with is actually the discomfort that comes from recognizing that as the leader, you didn't create this organization, but you inherited a legacy.
Mm-hmm.
It's yours. There's something in here, is something in this community. You did not create it. I think so many times we don't want to have the difficult conversation because it turns into shame and blame, senses of guilt. You and I have had the experiences of public officials saying, you can't say that X, Y, and Z because it's going to make me uncomfortable. No, I'm going to tell you the truth. It's not designed to make you uncomfortable. It's not designed to give you affirmation. It's not designed to do anything other than tell you what is.
Mm-hmm.
Now, what do you want to do with it? Because I think the veneer, the nice paint on the house is us talking about the brand new program that meets the dually diagnosed kids, that this high level of care that we have established, but it doesn't take into account that once upon a time we used to take people from one community and place them here when we didn't know what to do with them.
Right.
And without that level of assessment, we are bound to re-traumatize, which flies in the face. It absolutely belies trauma-informed care.
Yes.
Resisting re-traumatization is my calling, if in fact I'm a trauma-informed, trauma-responsive healing center leader. And yet it just seems like there's this pull and push. I want to keep the dollars coming. I want to do the many things, but I can't do it all. And I could feel the stress sometimes of people just saying out loud, how do you help them be trauma informed? I don't even know. And I don't see it just as an executive coaching piece as much as, are you really willing to do the assessment?
Mm-hmm.
Because if you were looking at my family, you break out all these tools, you break out genograms, and you'd sit down and do my psychosocial, and you would interview me about all the many things that happened in my life. But in this company, are we doing the corporate assessment? Are we doing the corporate psychosocial? Are we looking back in the history of this particular entity, how it came into being, under what social circumstances, and what have we done to transform it into the next iteration? My fear is that we've created nice spaces, professional spaces, even very caring spaces that aren't meeting their goals because they remind and they re-traumatize the people that had to go there. Imagine being a family, an indigenous family that has to go anywhere near a boarding school.
Mm-hmm.
To receive the service, to not receive a service. That's not the family not wanting the service. That's the family not wanting to revisit their pain. This is impacting the numbers, since the numbers are so important. Highest rates of suicide, highest rates of being diagnosed with schizophrenia, which to me is interesting. So we shouldn't have to be having conversations about youth, young adults, families that are not being diagnosed correctly. And I think even our regulatory groups and the folks that monitor psychologically based services, I'm thinking specifically about the American Psychological Association right now, they've had to come back and say that the ways that we've been doing this were wrong. You want to speak a little bit about how that even communicated this many years later impacts our mental health and our well-being, thinking that we were doing this the right way all this time?
Absolutely. And so the American Psychological Association issued an apology to people of color for their role in promoting, perpetuating, and failing to challenge racism, racial discrimination, and human hierarchy in the United States. And although they were created in 1892, this apology letter was issued in 2021. But it talks about their specific role in standing by as silent bystanders as people of color were being harmed through mental health, through inadequate and overgeneralized diagnoses, and the harms that racism played into this. Also, they talked about eugenics and various things that have been perpetuated throughout these years. And they issued an apology. They also issued some things that could be done, and specifically starting with them, that they would prioritize efforts in knowledge, production, and scholarship, making sure that they increase their culturally diverse information and productions and so forth. Also, that they will prioritize efforts in training, opening pathways and workforce development opportunities for students of color to pursue careers in psychology, promote the mentorship of psychologists of color, improve psychology, graduate education and training to diverse, non-Western cultural perspectives. And so we know that we talked about it earlier about the mirroring of the workforce with the clients who are engaging in services. And so we know that all of these things are important. They also spoke to their efforts in clinical practice and health equity and elevating advocacy and training for culturally competent, easy, accessible care models and those that improve the disciplines, knowledge of, and responsive to the needs of communities of color. And so I think this is important to highlight. I think in this summary, we'll also provide a link to the apology because there are more specific guidelines that they administered for not only their organization, but for organizations who are working in mental health. So I think it's important not only to keep in mind of this apology, but also I think it's validating for so many reasons for things that we knew that were happening within the mental health space that have been harmful to not only Black and Brown individuals, but to everyone. I think that's the importance when we talk about disproportionality. Certain groups may be feeling it more, but all of us are impacted. None of us are safe when disproportionality exists. And so being mindful of that and being mindful of the impact is important as we talk about these things.
I agree, and I support this. I think folks need to take a look at it, particularly service providers of today, working with, schools come to mind again. This idea of even behavioral threat assessment, being really careful. But when we're entering into our counseling sessions with children, when we're doing our MTSS, our multi-tiered support systems, when we're doing our work at the different tier levels that are found within it, to be really careful not to just begin with this diagnostic headset. That's not to poo-poo away the reality of needing criteria to assign behaviors to their right place, but make sure that there's a cultural context to it, not just you had a bad day and you acted out, so you're automatically going to need to go to a hospital tonight. You and your family now need to figure out high levels of care that may or may not be needed. Not all incidents that occur in a school require an SRO's intervention or law enforcement intervention. Some things can just be dealt with differently. Find out what's going on with that individual prior to just jump into the conclusion that there's some kind of pathology there that you need to fix.
Absolutely. And pay attention to what's occurring beneath the surface. So anytime you enter a situation, I think although this apology was given several hundreds of years later, it still matters. And so that's what I want us to be sure that we are not lost on the fact that these things happen and we understand them. And this is what we've participated in detail, but also this is what we're doing. And I think it's important for us to follow that model as organizations and as organizational leaders. Not only say, I'm sorry for what? I apologize for these things and this impact that I know that it has on you and all the other impacts that I'm not even aware of, that you may not be aware of, that will come out generations down the road. I apologize for this. And this is what we're doing. Because once you say, I'm sorry, and this is what I'm doing, you give people permission to hold you accountable to it. But if it's just, I'm sorry, sorry for what? And I need to know that you understand the impact and what are you going to do and how do we hold you accountable to that?
Even the APA is saying, hey, let's go easy on all these diagnoses, right? Because what you're seeing as something that's out of place is really probably a trauma reaction, and it's appropriate and it makes all the sense in the world. I think that that's transformative. That is moving beyond the drapetomania foolishness that took place once upon a time to let's think about this given the history of the individual sitting before you. What other capacities are being impacted? And by that, I mean not just health and wellness. What other areas or life domains, if you will, are families suffering with because of the historical trauma and the things that are being said at the kitchen tables?
Yeah, I mean, I think it exists across every facet of people's lives, where they live, whether you have clean water, whether you have clean air, where does the next plant move in? What community does the plant move into? From job applications and names on applications and resumes to various assets. Who gets a good deal on a home? Who gets a good deal on a car? I think throughout every system, disproportionality occurs with certain groups. And again, I think a lot of times, and I try to make sure that as much as possible that I don't participate in the othering. And one of the othering that I see that occurs is when we blame stuff on the system. And it's like, we are the system. The system is an accumulation of individuals who make decisions.
Yes.
And we can make good decisions or we can make bad decisions. And what we're seeing is accumulation of people who have gotten together, told stories, and facilitated actions that were destructive. And so if that can happen, how do we facilitate institutional equity? How do we facilitate institutional thriving, where we come together and we think good thoughts about people and we enact actions that align with our thoughts and beliefs about those individuals? And so I think it's that, for me, it continues to go back to how we think, because we are the system. And so if I get together and say, you know what, I think those individuals that stay in that zip code over there, like, they just thugs. They're not going to do anything with their life. They don't want to work. And I gather up enough people to think that those communities are impacted from birth, from even before conception. If you are born into that zip code in your mother's womb, there's already something being planned for your life. And we have to have that conversation about what are we doing and how do we disrupt that? And yes, it could be overwhelming, but everyone can take one action today. What is one action that you can take today to disrupt the activities that are happening within certain zip codes? And I think the other thing we have to do is take a look within ourselves and realize that sometimes we are not the right people. But in the absence of being the right person, how do I find the people that best communicate with these communities and pay them what they're worth? I know that gets us on a whole nother trajectory, but
that's a whole other program.
Yeah. And I think that's a part of being a leader, like understanding your limits and being real, being reflective of, like, am I causing more harm than good? And if I'm causing more harm than good, sometimes you are aware of the harm you're causing. And sometimes you think you're doing good and other people like, come sit over here and have a conversation with me. I will tell you that that's not okay. And being able to be humble enough and having enough humility to say, oh my God, I have contributed to harm, and how can I improve myself, versus doubling down on it and like, nope, this is the way we've done business for 100 years. We're going to keep doing it. And so I think it when we talk about human to human, it works both ways. Who are you showing up as a human to this work? And every interaction creates an experience, a negative experience or a positive experience. So when we talk about trauma, those are stories that have been passed down in addition to the experiences. I went to that particular organization and this is what happened to me, and it was bad. I'm going to tell that story to a whole bunch of people. And then you wonder why certain people don't come to your organization. What is the story in the community and how can you show up better? And so I think as we talk about this, I just want to make sure that we talk about the system as an accumulation of people and of decisions, that we don't get to blame it. Oh, no, the system did that. No, you did that. Like, you and your thoughts did that. Now make it right. Take action to make it right.
Yeah, that's a beautiful segue. I love the concept. Systems don't care, and yet we've created this huge terminology and have been using it for a very long time that says that there is this continuum of care. Inherent in the word is I see you, I respect you, I value the work that I do, and I value in the context of the work that I do. But systems unto themselves don't care. People care. So who are the people in these so-called overriding, process-driven, regulatory-driven, legally driven activities called systems? Who are the people that help navigate and help us make them make sense? I think there's some folks that are doing some tremendous work in that space,
Oh, yes.
but they are taking tremendous risks. They are innovating through the roof. Their allies are all in. They're doing the thing, and they're just as many, as you said. Business as usual is what we do, and anything that's not us, oh, we're gonna blame the reg, or oh, today it's a fear mentality when we start doing that, and I think we go back to historical trauma because that's what it was then too. Anybody who even remotely thought that what was happening was wrong stood to lose a lot, up to and including their lives. I see what you did to this person. I need you not to do that to me. And so that too comes down and is discussed at the kitchen table of how do I self-preserve.
Yes.
And not, despite what might be in my heart, what I'm not going to do to take this risk with you. I feel for you. I'm sorry this is happening to you, and I'm sincere about that. And at the same time, I'm not going to be able to do anything to help you with that. I don't know that we can't change the paradigms, but these paradigms have been in place now for any number of years. We've, like you said, built all kinds of very comprehensive arrays of services around this. Families sometimes are being disproportionately impacted because they just don't understand how to negotiate what has been developed. And if you've been on the outside looking in for decades, or your family has been on the outside looking in for generations, there almost doesn't seem like there is a answer to providing you access or getting you to the place that you need to be without a lot of community support. I'm thinking specifically about the promotora process in Latino communities and Latinx communities and Latinx communities. I'm thinking about ambassadors and communities of color. There's always that one person is like, okay, I know how to get you the appointment. I know how to work and negotiate this system. I have worked in this system for decades, and they're even being on the receipt of services have often been frustrated by trying to make it make sense. It just seems so overwhelming that it's not an excuse, as you said before, for doing nothing. I'm not advocating that we just lie down and say, oh, well, the system did something to me. But I also want to say out loud that how do these people show up in their authentic self if we're not showing up in our vulnerable, authentic self to them?
Yeah.
Why do they always, in essence, why do they always have to come to you to receive what you have instead of you finding these individuals where they're at, Laker jersey and all, and have that hard conversation about what can I do to build this bridge with you?
Yeah. And I think, there's so many layers to it, because I think I always say people will do the right thing by choice or by force. And I feel like we have processes that have been set up that incentivize this, that there are no consequences for it. And if we really want things to improve, there has to be consequences or some type of change in how we do business. And I will say one of the things that always stood out to me is with funding and funders, calling on funders right now. When we put a grant or some type of funding out, and the primary ask is, how many people did you serve?
Right.
And I don't know how many times I've seen that, and I've had to go in and add in, and this is what we did in their lives. And so until that becomes a requirement versus how many people did you serve, we're just going to continue this same narrative and these same things about, okay, they serve 300 people, so then the organizations that serve the most get the most money. What have they done in these people's lives? First of all, who did you say you were going to serve? Have you served them? And what has your impact been? Because if people are worse or the same with your intervention, what are we doing? And what are we funding? And I think we really have to take a look at that, because right now it's an incentive that you could go and say, hey, in this grant application, 25% of my community is suffering from mental health challenges, and they are undiagnosed and they're not receiving treatment. And you can say 25% this year, and next year you can write another grant and say 35%. And they're like, yes, let's give them fun. The next year is 45%. We are doing a disservice by doing that. And we know that change takes time, but there should at least be an impact that is being made. And if you're an organization, it should be a positive impact. And it should be by choice, but it should also be by force. Where is that in the funding that is requesting to know the impact that you're making? Where are the calls, the secret shopper calls to these families to see how was that service?
Right.
We just want to know what's going on. And I think it's those things that we really have to pay attention to. What is it that we're doing, and is it working?
I think to that point, you then wind up empowering, employing, recruiting non-traditional voices. Because whether it was history or not, I think some of the folks that got the most attention were the so-called educated. They had a lot of say. They could prove things through data, research, a lot of devices that most folks didn't even fully understand. What I'm hearing you speak of is more of an immersion into the community, penetrating the community by actually becoming a part of it and having it be a part of you. Not to empower me. Please don't offend me by telling me you're going to empower me.
Right.
It's everything I can do to wake up in the morning, and for some of these folks, and they are empowered, but they may not have all of the sense of power. They don't know how to use all of their authority and all of their power. But I hear things on the back end like, look at us. We did this great work. Therefore, we did a good thing. No, the recidivism numbers in our society is a reason for the health disparities. You've got, like you said, the same service, people accessing it the best way that they can. Nothing is changing. And so when they have that same need again, they go right back to the same service. So they're moving the needle and getting 4 yards ahead. Dr. Jacob Hahn was on the program, and he explained that generational component of all of us wanting for the next generation just a few more yards than they had the first time. And I agree with that. And coming from cultures where it can be so arbitrary, the thing that is going to set you back. You kind of go back to that, when does power show up again? That takes away my power as I try to recover, as I try to get better, as I try to be part of the body politic. Legislation alone doesn't do it. Legislate and adjudicate whatever you want. But I mean, we're down to the point where people want to legislate and adjudicate the words that come out of our mouths.
Yes.
And that in and of itself speaks to this really interesting, but very dangerous time in our nation's history again, where we're like, are we just repeating the old stuff? Because this sounds a lot like Cartwright et al. Like, we're just going to go back to, I said it, therefore you do it, or you're not going to get this, or you're not going to get that, and you're doing it you're not doing any help to us. Who's
Right.
us? Because these folks are hurting. So I do believe that non-traditional voices and voices that are willing to watch a person find their health again through the experience of their culture, right? They're not being isolation. They're not being siloed on purpose. But I know you speak a lot to this idea that I have to go back to home with my people to make sense out of this pain. It's not at the expense of anybody else. It's not to harm or hurt anybody else or to make you uncomfortable. It is so that I can reconcile what's going on so that I can get better. And then I'll know how to
Yes.
work with your system. A fully empowered partner in whatever it is that we can agree on to do to help others like me, and maybe even use me as an agent if I'm a change agent ready to give back to my community. Are you seeing that there are organizations that are willing to do that? Are you seeing that, I just said a lot of words, but are people truly buying it? Or is it just, it sounds nice, Mordecai, but we're not doing that?
Yeah, that I think there are organizations who are buying it. And I think it's very interesting because as we talk about history and we talk about Draketomania, there are connections to this because it's almost like a brainwashing. Like you are being abused and you want to run away, and now you are being labeled because you want to run away from abuse. And now that gets in your head of like, how many people internalize that? How many people said, maybe I do have Draketomania and normalize like, I should be okay being abused. And so how does that look in our communities as we're doing this work when we go into the community and like, this is how you should do this? And people like, no, I don't think that works. And working at child welfare, how many times do we see people who took parenting classes over and over again and could teach the class, but we're still showing up in the system? And so it's that of like, whoa, like your book is not it. Your standard that works for you and whoever your community over there, and not even all your community, that does not work over here. And it takes a big leader to be able to, and not big as in, but someone who has done the work to be able to say, you know what? I've spent all of these thousands of dollars going to school. I've written all of these books. I've been told all of these things. And guess what? It's not working and it's wrong. And it takes someone big to be able to say, everything I learned, some of this is not true or none of this is not true. And I'm going to position myself in the form of a student to learn. And that takes courage. That takes sacrifice, and it takes vulnerability, but it's necessary as a leader to say, I have no idea. Please help me understand.
Yes.
Because I want to help you. And I see people coming to that. And I've seen a lot of people, and hats off to them, because that's a big deal. And it shouldn't be. But when we talk about power and what we have deemed to be a leader, just to say these stories of what it means to be a leader, you're supposed to know everything and you flex your power and you show them that you're in charge. And it's like, that's cute, but it doesn't work. And the numbers are showing that it doesn't work. And so as we move away from that and saying, and we know with technology, things could have worked last month, and this month it doesn't work anymore. So what is the data saying, and how are you positioning yourself? And I always say, whenever you go into a community or whenever you're working with the individual, it's important to be a teacher and a student. I don't care how many years of expertise you have. You are not the expert in somebody else's life. You may be able to give them strategies based on your experience or based on your education, but you are not the expert in their lives. And once you start going to people and saying you need to do A, B, and C, and they don't do it, and they're othered or devalued or given a diagnosis because they didn't do what you said, or they did something that was unfamiliar to you, that's problematic. And so I think that is what I've seen. I've seen people that have doubled down on it, but I've seen providers and individuals who are really getting it, that you go into this community and you first identify the community strength. You are not going in as a savior. You do not have all the answers. You are there to teach and you are there to learn, with learning being the primary thing. And so I've seen people be brave enough to do that. And I think for me, that is promising and that is hopeful.
I would agree. I love the way that you put that. And there's got to be something. I don't think that a something is always a curriculum at this point in my life. And I definitely don't think it's always a training. But I do believe that there's a learning. And I'm not even going to go so far as to say that I know what that looks like for everybody. And I think that's a good thing. Everybody should come up with their own idea for the way that their organization is going to facilitate what you just mentioned. How do I build these bridges in my communities? Even if I don't live in them, they are my communities if I have to lead the people who work in there. And many of the people who are working in these organizations live in these communities.
Yes.
And so I think that there is something about building out and allowing the vulnerable leaders going to allow that base to educate them, tell us what's really needed. Let's figure out who the thought partners are. Let's figure out who the collaborative partners are. Let's not just make it something that we wrote in a grant and we wrote some MOUs and some MOAs, which are just memorandums of understanding and memorandums of agreement. That's usually entity to entity, system to system, if you will, but not person to person. It doesn't talk always to that impact of the individual. I think you get 3 types of impact in our work. Positive, like you said before, negative. But to me, the worst of them all is the one that, in my opinion, influences this disproportionality, is neutral impact. That means you came into my community, you did something which you thought was so powerful and nothing changed. The same problems we had when you got here, the same problems we have right now. So we're going to go over here and try to figure out how to work this out ourselves, which also is starting to happen. How are we building connections with grassroots groups, culturally centric groups? There's a lot of healing that needs to take place in these communities, and they're healing for self. We've done some work with some tribal communities, and it's fascinating to, number one, give respect and honor to the fact that that needs to happen in their space, but also to learn some of the ways that we have to go back to figuring out how to heal ourselves in order to work with you, so that we can do the collaborative efforts that you aspire to. Nothing wrong with the collaboration, especially if it's in response to these health disparities. But I think sometimes that we're looking at equitable outcomes for everyone that look the same way for everyone, and they're going to be very person-centered. They just have to be. I found a really good article in my research, No Wrong Door, a holistic approach to human services, came out of governing.com. No Wrong Door is a people-centered solution for human services specifically that provides a universal gateway to community and government programs. To extend the reach of service provision, while acknowledging the complexity of navigating the variety of complex services in a community, social service providers, along with regulatory agencies, were encouraged to create more effective pathways to service, regardless of how a person entered the system of care. Ideally, providers are viewed as navigators, ensuring the presenting need of the client is met, even if the provider being engaged does not provide the service being requested. You see, ultimately, there is such a thing as a wrong door. Oddly enough, the wrong door in history often presented as the only door or access point to service that BIPOC could use. At least it was the only door the person is willing to use in a time of need. The wrong door could be considered the most logical door, for certain groups could not walk through it at all, or were made to use a different, less effective version of the door
to satisfy the desires of majority culture. Ultimately, controlling the door is controlling access of the person needing the door. It's that simple. Intentionality remedies the misuse of power. Leaders can assure the communities they serve, no matter their choice of doors or the needs that drive folk to open them, they will be received on the other end of those doors with respect.
So, Dr. T, I want to go back in time a little bit again, if you'll indulge me. I remember a time in our business, this idea of a system of care, going back to the system of care. And for those of you, again, who are just joining us, a system of care is a comprehensive array of services. Think of it like a mall, where all of the services that you might need or have to encounter are in the same place. Doesn't mean they all work together, much like your mall. One store may be selling educational services and the next one selling legal services, but they all are present in your community. Big challenge for those folks shopping at those malls, if we're going to use that ideation, is when do I go into which one? And I feel like when I'm at the mall, I have a big map and it says where I'm supposed to go, but I don't necessarily know how to go there. I don't know where I am. It has a big sign that says you are here. And if my daughter's not with me, I'm still getting lost in that mall. That's happening to people who are trying to access services. And I think there's two pieces I'd like to explore. The first being the access. And then this idea that kind of came out, innovative organizations and even systems started to say, we're going to create a system where there is no wrong door. You can't get it wrong. Let's talk about what the pluses to that and maybe some of the good intention behind that. But then let's also talk about some of the realities, if we could have some real talk about this, because I've always struggled with this in my professional life.
Absolutely. So where would you like to start?
Let's start with the access piece, actually, because I think the access impacts the doors that you choose.
Yeah, so I think that's a great question, because even within the access, there are two different paradigms to that. First is, can I enter? And the second is, do I want to? Like, do I want to go to that mall? Does that mall have things that I want? And we've seen that specifically in real life in some of the malls that have had many stores going out of business, and you walk in and it's like, no about this, like this is not my mall. And so even that, so when we talk about access, are services accessible to people? Are those services in those communities? And can they be accessed through people who look like me, from people who understand my experience, from people who are able to help me find hacks for my life and my situation that are culturally appropriate, that are culturally responsive. And so when we think about access, we have to look at it through all those things. Who are these individuals in the community and what are their needs? And how do we know that that's their needs? Did they tell us, or did we just think like, I think this probably will work for them? And yes, people need housing, people need transportation, people need stable utilities and stable resources in their community, but how do they want them? And are we providing them in that way? Or are we just doing it on our own? And so how are we working with the community? And so when I think of access, I don't think we can talk about access without talking about the access being community informed.
I appreciate that. And I agree. I think that I'm always amazed when folks say things like, we can't find people to hire. And then you look at the data, or like, as we said in our last program, you look at the zip codes and you're like, there is no possible way you can't find people that will meet this need in this community. That's almost statistically impossible. So what are you doing to recruit? What are you doing to bring people on, or even build new pipelines, new recruitment pools to allow these folks to be the helpers the next breed of helpers, the next generation of helpers. I was always of the opinion, I've worked for some organization, one that comes to mind I remember that it had a department named Access. And I used to think that was nice. But I didn't get a sense that it was real, if that makes any sense. Having the service doesn't imply need satisfaction, nor does it imply service quality.
Right.
Right. So I think of what you just said in terms of walking into this mall and going into that store. I've been that person. It's like, oh, I'm not shopping in here. I don't know what's going on in here, but you lost me after the parakeet, flew over my head. Like, I'm done here. No. So I think that our families do have some of that same experience. They walk in and then they get some visceral response. It could be because of former things that remind them. It could be because of what their families have gone through. And they say, listen, when you get there, if you see so-and-so, just turn around and go the other way, because nothing's going to get done today. That person is not very nice. They're not very welcoming and warm to us. I don't know what a problem is, but I would strongly suggest that you not go in that place today. So I do believe that this idea of disparity can be influenced simply by how welcoming or not our corporate entities are. How are you running your shop? And does it meet needs? If it doesn't, then why are we saying that these folks don't want the service?
Access isn't a catchphrase. It's not a clever name for service marquees or departments within organizations providing crucial mental health and or behavioral health services. Creating access points that are viable and welcoming to the community, are seamless and easily navigated, may be the only opportunity for certain cultural groups to feel a true connection to the service being delivered, to develop connections with the providers, to become versed on the service and how it works to meet their unique needs. Leaders, on the other hand, committed to promoting access, are willing to be taught, educated another way. Their education, dare I say, may be less academic, less focused on data, and more on impact, employs culturally relevant approaches to service delivery, seeks lifelong learning, and never, ever repeats atrocities.
Thank you for tuning in to our production of Talking Beyond Trauma, which is made available by the South-Southwest Mental Health Technology Transfer Center, or MHTTC, through a cooperative agreement funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. The MHTTC's primary goal is to provide free training, share best practices, and offer ongoing support and consultation to professionals serving individuals with mental health challenges. We would like to extend our gratitude to our guest, Dr. Tonicia Freeman Foster, and our host, Mordecai Dixon, for their contributions to this discussion. Lastly, we would like to acknowledge the hard work of our dedicated team, without whom this project would not have been possible. Season 4 was produced by the communications team here at the Texas Institute for Excellence in Mental Health. It was recorded and edited by Mckenzie Bentley. Our theme music is by Scooter Holiday. The opinions expressed in this presentation are the views of our speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. If you'd like more information on this and other MHTTC products in the South-Southwest region, you can find a link in the episode description. This session was pre-recorded. We appreciate your participation and hope the discussion helped your journey. Be well.